Hi, everybody. This is Dr. Michael Hirsch, Director of the Division of Public Health for the City of Worcester and the Chief Pandemic Officer, here with another session with our dear friends at the Worcester Senior Center. I love these little talks that we have, and you know, this is a wonderful time of the year. We're in full holiday mode now. We've gotten through Thanksgiving, and here it is just a few weeks from Christmas, probably in the middle of Hanukkah and Kwanzaa and a lot of other great holidays. No matter what religion you are, there's something going on in the month of December that you're going to be celebrating. And boy, think about this, okay? We've come a long way since last year. Last year, I remember doing one of these sessions where I was urging people, try not to do a holiday celebration with your family. We didn't have the vaccinations yet against COVID. We knew that with the transmissibility of the virus indoors, that everybody being indoors for the holidays was going to be a risk. And particularly if you were going to be doing one of those multi-generational parties like people love for the holidays, with grandparents and little kids and all the ages in between, wasn't going to be very safe. So we were just telling everybody, just do a Zoom if you have a computer, phone people, talk to them on the phone, support them other ways, and just keep your gathering very intimate. Your bubble, we were calling it the bubble. The bubble was your immediate family that you had some idea was taking the precautions that we were recommending. What were the precautions? Masks. Masks were the only thing we really had, along with hand washing and watching your distance, right? The 3 W's, that was what I was talking about last year. This year is a different ball of wax. We have the vaccines. We've had them since January. And we have a community here in the city of Worcester that's about 60% vaccinated totally. That's not as high as I'd like it to be. The state of Massachusetts is at about 72%. We are lagging behind. But 60% is not terrible. And the problem now is many of those people, including you seniors that go to the senior center, you got your vaccinations very early because that's how we ran out the vaccinations. You were the top tier of people because we saw what devastating results the virus had in the elderly community. All of those poor people in long-term care facilities, all those people at the Holyoke Old Soldiers Home that passed because we saw this virus hitting those communities and just driving through them like a freight train. And we didn't want that to happen. So we got to the seniors very early, and your group demographically has an 88% vaccination rate, which is terrific. But what we have learned now from studying results both here in the United States and in Europe and in Israel is that after about 6 months, particularly in the elderly, your immune levels drop down. So that is why you've been hearing a lot in the news about booster shots. And just a couple of weeks ago, the FDA decided not to do anymore a tiering system or a particular kind of demographic that needs booster shots. They said everyone older than 18 should get a booster shot. This booster shot is not the full dose that you got the first 2 times if you got Moderna or Pfizer, or the first time like when you got Johnson & Johnson, if that's the one you got. It's a half a dose. And it only has to be given once. And the great thing about it is that within 2 days, you achieve a 98% increase in your immunity. So it's a very quick fix for slowing down of your immune response. So we're trying to get everyone to get out there and get their booster shot. And you know, we're not even sure if you're going to need another one afterwards. With the flu, we get a vaccination every year because the flu keeps changing on us, and we try to guess what strains are going to be predominant, and that becomes the flavor of the flu vaccine each year. We're not sure about COVID. We're not sure if COVID will continue to mutate. If we get enough numbers of people vaccinated, it may be that this booster may be your last COVID shot, kind of like what you got for polio and what you got for measles, mumps, and rubella. You might not have to have another. We don't know. We're still studying it. And that's one of the things that I know the seniors have understood better than almost any other part of the population. We're studying this because no one had seen COVID before. And it has taught us many lessons. We had a game plan for COVID Alpha, the first COVID virus that we started to see back in January of 2020. Now, 2 years later, what we have found is over the last year, we've been fighting the Delta variant, and that has been a beast. It's much more transmissible, it's much more deadly, and it spreads like wildfire. But the vaccinations work great against it. So why haven't we knocked it out? We've had vaccinations since January. People have been asking me, Dr. Hirsch, we had more viral infections this year, 2021, than we had last year, 2020, when we had no vaccine. Well, back in 2020, when all of the city governments around the Commonwealth said you got to lock it down, all of the citizens complied, and we locked it down. We didn't have school. We didn't have a lot of indoor retail outlets. We didn't have restaurants. That's how we got through the first wave and second wave of the pandemic. Once the vaccine came out, I think people and cities got a little bit looser because they said, now we're going to be protected. And we thought, based on how everybody was reacting to getting the announcement that the vaccinations were available, with all of the people that were trying to get in, do you remember those days in January and February you were trying to get a shot and you just couldn't seem to get one because supply wasn't great, the online system to get it wasn't great? And here we were trying to calm everybody down. You'll get it, you'll get it, you'll get it. Well, the people who wanted it got it. But the people who didn't want it, and we'll talk a little bit about why they didn't want it, they didn't want it, and they still haven't gotten it. And so we still have this segment of the population that is not vaccinated. And they vary as to why they're not vaccinated. There are some that are just distrustful of vaccine in general. They don't believe in any of the vaccines. And there are some that just don't like the government. They just don't believe the government anymore. They don't believe in public health recommendations. They don't believe the president when he comes out and says you should get a booster. They don't believe anybody. Then there's a group that is traditionally distrustful of the medical community. So the black and brown people of this country have been mistreated because of the institutional racism of medicine for decades, and they're not buying it. In many cases, they're just saying, I don't want it. And then there's another group that is just scared. They think that this vaccine was developed too fast. It's experimental. They don't trust it, and they're going to hang back and see how everybody else does and make sure that there's no funny reactions or complications from getting it. Maybe then they'll get it. But in those groups, those four groups that I just mentioned, they are the ones, when they're exposed to the Delta variant, they get the disease, and not only do they get sick, and they're the ones that are coming into the hospital now. We're not getting overwhelmed with it yet because of so many people who have been vaccinated. But the 80% of the people that are being admitted are people that are unvaccinated, right? Only 20% are getting admitted who have been vaccinated. They have what are called breakthrough infections, and I'll come back to breakthrough infections in a minute. Unvaccinated are allowing this virus to continue to duplicate and spread. And when the virus duplicates, it makes mistakes. And sometimes it makes copies of itself that are really harmless, and that line of copies will just die out. And sometimes it makes a copy of itself that is much more dangerous. That's how we got the Delta variant. The Delta variant is a bad copy of the first Alpha variant that we faced back in January of 2020. And it's been a beast, as I said. So we don't want this continued propagation of these bad variants, because sooner or later, a variant might come along that can resist the vaccines. All of the vaccines are able to fight off the virus in your body by teaching your immune system how to hate the spike protein that's sitting on the outside of the coronavirus. It's sitting on the outside of the Alpha variant, it's sitting on the outside of the Delta variant. But could a viral variant come along that doesn't have a spike protein like that? Yes. And if that happens, our vaccine will be rendered ineffective. Right now, it's about 90% effective. It's keeping people out of the hospital, it's keeping people from getting severe infections. If they get into the hospital, they're not going to the ICU. If they're going to the ICU, they're not dying. But we need to get those unvaccinated people vaccinated, and we need to protect against these breakthrough infections by getting the booster. Breakthrough infections are infections in the people who have been vaccinated that have 2 shots or one of the Johnson & Johnson, and they're just too far out from the original shot to have as much mature immunity as they need. That's what we need them to get boosters for. And that's what we're really emphasizing. And the other group that we're really emphasizing right now is in the 5 to 11-year-old children. They just got the authorization from the FDA to have the Pfizer shot. It's a third of the dose that other people get, and it's very well tolerated. We've done probably about 1,500 now in the Worcester schools, and the kids have done great. They've been so brave. Our volunteer group that's been working with them has been specially trained in doing this well for children, and it's been a beautiful thing. But the percentage of little kids of that 5 to 11-year-old group that have gotten the vaccine so far, even though it's available, is only about 35%. So we've got a lot of work to do on the boosters, got a lot of work to do on that 5 to 11 group. Because what's happening is the unvaccinated parents are sending their unvaccinated kids to school. Those kids are getting the infection from their unvaccinated parents, bringing it to school. They may not get sick. They may be silent spreaders of the virus, but they spread it to their teachers, to their bus drivers, to their lunch ladies, to their little classmates, who then bring it back to their families, and those are the clusters that we're seeing. So that's the bad news right now, is we're seeing a little surge again. We're up about 80% over the last 4 weeks of the number of cases that we're seeing. Nationally, we are still at a level of about 1,100 to 1,200 deaths a day and 90,000 new cases a day. That's way too high to say we're done with this. Imagine 1,000 deaths a day for the next year. We'll have another 365,000 deaths to add to the 775,000 deaths that we've already had. That's just way too much. We've got to knock this thing down. So as you are preparing for this joyous holiday season, those are the things I want to talk to you about. Again, I trust you as elders to be our best messengers in families. You have the respect of your families. You've been through a lot, you have the wisdom, and they look to you for guidance. And what I would say if I was an elder, if you want me to be at your Christmas party, if you want me to be participating in indoor activities with our family, you got to make sure that your kids get vaccinated, you got to make sure that the adults are all vaccinated, and you got to make sure that anyone that has had a shot more than 6 months ago gets a booster. That's the way to go. You yourself, as a senior, if you haven't had your booster yet, you need to set the example and tell your daughter, your son, whoever is going to be the one driving you to the vaccination centers, I need a ride because I need a booster. It's very easy in Worcester right now. The Worcester Public Library, every Wednesday and every Saturday, there are hours there for boosters and for little kids too. And we have clinics going on in the Worcester Public Schools and all of the major pharmacies, CVS, Walgreens, the pharmacies that are inside of the big supermarket stores like Wegmans, ShopRite, they will all be able to schedule for you a booster. Or if you have a loved one that hasn't had a shot yet, a vaccine. And these should not cost you anything. If the insurance companies will pay for it if they don't cover it in your insurance, or if you're not insured, the government eats that money. So you just have to fill out some online forms. And if you're having trouble with that, you can always look to www.worcesterma.gov, and there's information there about how to get help in filling out whatever forms you need. But if you could get your gatherings really vaccinated up, you'll have a very, very different kind of Thanksgiving and Christmas that you had last year, because you won't have to wear masks. You can gather together. There's no bubble anymore. Everybody that will come, hopefully, will be doing what you've recommended. But if you have people that you know are not vaccinated, if they're in that group that I mentioned, the ones that refuse to get vaccinated, they either shouldn't come out of courtesy to you because they're putting you at risk, or they should definitely be masked up during the time that they're indoors with you. That's the only way that we can keep Christmas from being a super spreader event. We don't want to see that. As I mentioned, thus far, the hospitals have been dealing with this increased number of cases because so many of the cases are breakthrough cases. The breakthrough cases are people that had their vaccination. They're not coming into the hospital. They don't feel well for a few days, but they're not sick enough to come to the hospital. And that's really a tribute to how effective this vaccination is. And we want to keep that vaccination effective by getting the boosters, by keeping the number of bad replications of the virus from yielding one that will be immune to that vaccine. We don't want that. We don't want that. So that's really what my message is, besides that I'm wishing you a wonderful holiday season. And I am also so optimistic that 2022 will be a return to, I think, of a fairly normal life again. Is it ever going to be like it was in 2019? Probably not. We're going to be much more aware of outbreaks. I hope that we'll be investing a lot of money in trying to prevent some of the bad public health responses that we saw in 2020 because of the lack of funding, the lack of infrastructure. I don't think we're going to be caught with our pants down like we were as badly in 2020 ever again. But still, I think it'll be much more normal with lots of activities, lots of fun. And don't we all need some fun? I certainly do. So I want to end on a personal note. You know, I'm always finishing off these talks with a little bit of history stuff. So this is really personal history. I think I have mentioned to you in the past that I had a 96-year-old mother who was living in New Jersey. She was living independently in a condominium at the time of the outbreak of the pandemic. She just had a home health aide that was with her during the daytime. But that home health aide was in her late 50s and was very afraid of getting COVID. And she was a wonderful person, but she was very honest with me. She said, I don't think I can come there anymore. I'm afraid of spreading it to your mother, and I'm afraid of getting it. So we had to arrange 24/7 home health aides in a rotating basis. And so my mom lived that way till the end of her days. She wasn't really happy about having them in the house. She wanted to be independent, but she had become totally blind because of macular degeneration, and she was very hard of hearing. And there was no way she could sustain herself. And she admitted it. After about 2 months of complaining, she finally admitted that she was dependent upon these aides. And they were wonderful to her. They became like family. And they identified problems. They troubleshooted with medications that hadn't come in time. They gave me clues as to whether they thought my mom was depressed or not. And I tried my best. You know, we were locked down for a long time. I couldn't see her. I didn't see her for almost 6 months last year. And it was a very sad time. But one of the things that really made her enthusiastic and happy was knowing that I was trying anyway to help out in the senior citizen population here in Worcester. She was very happy I was doing these sessions. She was very happy that I was having regular meetings with all of the people that helped to manage the long-term care facilities. I was doing town halls where we were really trying to pay attention to the needs of the seniors, trying to get the ones that were not mobile to get vaccinated once we got the vaccine. And she loved these sessions. And I used to, when I visited her, I used to play them for her on my telephone because I would dial them up on the video archive for the city. And, you know, she would always critique it. Oh, that was a good thing to say. Oh, I think I would have said it this way. My mom died on November 7th, and we buried her a couple of days after that. And I'm very, you know, I'm in that phase of my life where I'm feeling very sad about the holidays without her, because she was everything. She was a force of nature. When she came up for these holidays, she'd take over the kitchen. Even though she couldn't see anymore, she would be the supervisor of all cooking, and she held court, and all the grandkids and everyone else would come and talk to her. And her crowning achievement this year was that she was able to attend my daughter's wedding, which was the end of September. She willed herself up to come to that thing. And she held court there, and so many of the friends of my children and my friends, my wife's family that had known her for all of these many years, 96 is a long time, right? Came over and kneeled down next to her wheelchair, and with her very poor hearing, whispered in her ear who they were, how they had met her, how long it had been since they'd seen her. And she remembered all of those things. And for the last 2 months of her life, we spent almost every day, at least one time, remembering something about that wedding. She got her shots, and she got her booster, and she was a good citizen. You know, she was a Holocaust survivor. So she was very philosophic about the kind of deprivation that she was facing during the pandemic. She said, yeah, it's pretty bad to be isolated and stuck in your house, but it's not so bad when you have food and you have heat and you can make phone calls and you have loved ones that care about you that come to visit. That's very different than what I experienced in the time that I was in concentration camp. So I just wanted to thank you all at the Worcester Senior Center and all of the folks that listen to these broadcasts for having given me the opportunity to be with you on a monthly basis and talk, because it made me feel like I was doing something for the greatest generation, and it made my mother feel like I was really contributing to a group of people that she really felt were underserved. So I wish you all the best. I want to thank you so much for the opportunity to be with you. I look forward to being with you again in 2022. Please be safe, be well, and happy holidays, whatever kind you celebrate.